this annual World Atopic Eczema Day is said to be observed on the 14th of September. Now, this is a day that is dedicated to raising awareness about a disease which places a heavy multidimensional burden on patients and caregivers. The theme for this year's global campaign is Inside Atopic Eczema, and it looks at the 5 major burdens of the disease. Now, for more on this, let's chat to pharmacologist and Sanofi Medical Advisor, Dr. Dwayne Koot, and he joins us on Zoom. Sir, good morning. A warm welcome to Morning Live. For somebody who may not know, let's first give the definition of atopic eczema. What is it?
Morning, Level. Well, atopic eczema or atopic dermatitis, or more frequently referred to as just eczema, it's a visible skin condition. It's a chronic systemic inflammatory condition. As I said, it displays with visible lesions on the skin, but more so if we look inside atopic dermatitis is this multidimensional burden that you mentioned. So these poor patients, they really are suffering from this extreme itchy skin, which can lead to serious sleep deprivation. And we all know that sleep deprivation can have a knock-on effect on various aspects of our life.
Now, what are the leading causes of eczema or atopic eczema?
Well, there's certainly a strong genetic component. So these individuals are genetically predisposed to developing atopic conditions such as atopic dermatitis. Furthermore, there's an inflammatory component. So the genetic component leads to a dysregulated immune system, which leads to this inflammatory systemic condition. And all of this put together disrupts the skin barrier such that the skin barrier is essentially broken. It allows the loss of water through the skin, making the skin quite itchy. And also because the skin barrier is broken, it allows allergens and pathogens into the skin, which gets the immune system sparked up even more, which again leads to the breakdown of the skin barrier. And the cycle goes round and round, trapping the patient in this itch-scratch cycle.
And doctor, what is the difference between your, I don't want to say normal eczema and in reference to what we are talking about? I remember my son still has eczema at the moment, but it's not as extreme as you are referring to. So what is the difference between the two?
There's various forms of eczema. Atopic eczema is also known as atopic dermatitis. This is the most common form of eczema, but certainly there are other forms. And it's important to mention that atopic eczema is clinically heterogeneous. So what I mean by that is that there's a range of severities, ranging from mild to moderate to severe. Most individuals, probably about 80%, would have very mild disease, which could be managed quite easily with frequent and liberal application of moisturizers. But then as we move into the more moderate to severe disease, which could be about 20% of the population, then there might be a need for prescription topicals and even systemic medication to bring the disease under control.
Now, speak to us about one of the 5 major burdens of the disease. Which burden would you say is the most common and severe?
Yeah, thanks for bringing that up, because that's really what this year's Awareness Day on the 14th is all about. It is a multidimensional burden. To stress, one of the characteristics of atopic eczema is the itch. The itch has been described by some as being a bone-deep itch and even feeling like pain. So you can imagine that a patient who's itching, it often gets worse at night. They're not going to be able to sleep. For spouses and for caregivers, if you're looking after a child and your child is itchy and can't sleep, the caregiver's not going to be able to sleep either, leading to productivity losses the next day at work or at school. Furthermore, because it is a visible condition, there is a huge psychosocial and emotional burden. There perhaps is also a bit of a stigma attached to the disease, with onlookers not knowing what it is, thinking that it might be contagious, and this is certainly not the case. Furthermore, there's a bit of a burden on finances. Again, it depends on the severity of the disease, but in terms of the purchasing of moisturizers and the prescription medication, there could be a financial effect on that. And then daily management. If a large proportion of your body surface area is covered by these lesions, it's going to take quite a bit of time to apply the moisturizers and the prescription topicals onto your skin, and you probably need help from your spouse or caregiver. Furthermore, because this disease has got such a high impact, it changes the person's life decisions. They might want to isolate from society. They might not pursue their goals in life in terms of study or work because it's having such a big emotional burden on them, and they just want to withdraw from society. So as you can see, it is a large multi-dimensional burden. It's not just the visible aspect of the skin lesions.
Yeah. And now this year's global theme is Inside Atopic Eczema. Unpack this for us, please.
Yes, so the visible aspect of it is what everybody can see, but underneath that is this huge multidimensional, the psychosocial, emotional burden that's inside the disease that is largely underappreciated by the public at large, by health policy decision makers, perhaps even by friends and family who might refer to it as just being a skin condition. It can be so much more than just the skin condition when you consider the psychosocial impact, which could even lead to severe anxiety, depression, perhaps even thoughts of suicide in severe cases.
And take us through how one can go about managing it.
Management of atopic eczema is really stepwise. The mainstay of management is frequent and liberal moisturization. I've heard from a prominent allergologist that he would tell his patients to apply moisturizers 10,000 times a day. Now, of course, that is a bit of an overshoot, but it does get the message across to the patient. Instead of itching, apply a moisturizer. Thereafter, we need to consider if there are any environmental triggers, and of course, to avoid those triggers. Commonly, soap needs to be substituted out for an aqueous cream, and there are the general measures of skincare, gentle skincare, which is the mainstay of treatment. After which,
Dr. Koot, are you still there? Dr. Koot? Well, it seems we might have lost Dr. Dwayne Koot. He was explaining there how do you go about managing atopic eczema. And he was talking to us about this year's World Atopic Eczema Day that's taking place on the 14th of September.